One reason that adult ADHD has not been recognized regularly in primary care practices is that it's not viewed as a disorder that has a high degree of severity and that's costly to the patient, to the families, and to society. This is a mistake, and this mistake is due to the lack of training of primary care doctors about adult ADHD. We now know that ADHD is associated with many adverse outcomes. For example, there are many comorbid disorders that occur with ADHD. ADHD children are at higher risk for developing depression, substance use disorders, bipolar disorder, antisocial disorders in adolescence and in adulthood. But these types of disorders will emerge. Many of those will be seen in the primary care office, and they'll be mistaken as the patient's primary disorder. The ADHD won't be recognized, when in fact the ADHD was one of the underlying causes. Criminality is not something that we expect to see in all ADHD patients. It's relatively rare. Take a look at prisons. In prisons, 25% of prisoners have been diagnosed with ADHD. They end up in prison as, in a sense, the prison has become a treatment for adult ADHD, when in fact these people could have been treated much earlier in life and perhaps prevent their criminality. Adult ADHD also causes difficulties in the workplace. These have been well documented. This leads to occupational failure, low productivity. Another, if you will, hard outcome of adult ADHD are traffic accidents. People with ADHD are distractible. They're not paying attention. When they're driving, they're more likely to get into accidents. That can be deadly. Yes, ADHD can kill. We did a study of 1,000 ADHD adults in the population of the United States. One of the fascinating findings was that ADHD adults were failing at all levels of achievement. And what I mean by that, if an adult had graduated from high school and received straight A's, that ADHD adult was more likely to do poorly in their occupation compared to another adult without ADHD who also had achieved straight A's. So even at very high levels of functioning, ADHD is impairing achievement. ADHD can wreak a very difficult toll on the family. ADHD adults are at high risk for divorce, and there are high levels of conflict in ADHD families. These are unnecessary because much of this could be resolved if the adult had proper treatment. And finally, it's worth remembering that ADHD is a chronic disorder. The chronicity of untreated ADHD means that these impairments are accumulating over years and years and years. And so by the time the ADHD adult is 40, their life is in a very difficult state that is more difficult to address with treatment because it hadn't been addressed before. The cumulative impact of adult ADHD in society can be measured by health economic studies. Well, we did this in a study of ADHD in the United States a few years ago. And when we tallied up all of the work absences that adults with ADHD had, when we tallied up their lower productivity at work, and we put this into a health economics model, we computed that adult ADHD costs the U.S. economy about $100 billion a year. The bottom line is that by treating ADHD, you not only help individuals, you help their families, and you help our economy by helping us improve productivity. There are good reasons to believe that treating adult ADHD in primary care practices will reduce costs to society and improve the lives of individuals. We know that the ADHD medications that you would use to treat patients are highly effective. I myself have reviewed this literature extensively over the years. I can tell you that ADHD medications are some of the most effective medications we use in psychiatry. So there's no doubt that these medications help ADHD adults.